Hi and welcome to a lecture on gastroesophageal reflux disease. Gastroesophageal reflux disease is defined as the retrograde movement of gastric contents from the stomach into the esophagus. It is important to note here that reflux may occur without consequences and thus be considered a normal physiological process, or it may lead to profound symptomatic or histological conditions. Hiatal hernia. Hiatal hernia or hiatus hernia is an anatomical abnormality in which part of the stomach protrudes up through the diaphragm into the chest. It should be noted here that normally the esophagus passes down through the chest, crosses the diaphragm, enters the abdomen through a hole in the diaphragm called the esophageal hiatus, and joins the stomach just below the diaphragm. Pharmacologic choices. Whenever possible and appropriate, it is important to eliminate drugs that would impair esophageal motility and lower esophageal sphincter tone. This includes, for example, the anticholinergic agents, beta blockers, calcium channel blockers, theophylline, and the tricyclic antidepressants. With reference to trivial or mild gastroesophageal reflux disease, most people with mild symptoms do not seek medical attention and will obtain symptomatic relief with the use of antacids, alginates, or the histamine 2 receptor antagonist. Additional therapy becomes necessary if the severity of gastroesophageal reflux disease increases. Prokinetic agents. The basis for acid reflux, as we know, is incompetence of the anti-reflux barrier, impaired esophageal clearance of acid, and delayed gastric emptying. Prokinetic agents stimulate esophageal motility and increase the tone of the lower esophageal sphincter. Patients with moderate to severe gastroesophageal reflux disease may benefit from the addition of these medications. But it should be noted here that there is no effective motility agent available at this time. Metoclopramide has numerous adverse effects such as sedation, depression, and extrapyramidal effects, which limit the usefulness of this agent for many patients. In step-down therapy, once symptomatic relief has been achieved with the full strength of proton pump inhibitors, the intensity of acid suppression is gradually decreased with the use of the lowest dose that provides symptom relief. Half of the healing proton pump inhibitor dose may be sufficient.